Okay. So, how long have you been a nurse?
So I graduated in December 2014. So, I took my NCLEX in 2015. And so I started as an RN in like May 2015.
Okay.
So,
Awesome. Awesome. Um, I'm sorry.
sorry, about 7 years.
7 years. Okay. Okay. So what advice do you have for, students who are about to begin their journey with taking pre-nursing, courses or just getting ready to start their first semester of nursing school? What would you say is like something that's super important to know or that you wish you would have known?
So there are many different nursing programs. If you don't mind me asking, like, what type of program are you applying for? Is it like a 4-year, a 2-year, BSN? There's so many out there. Is it an accelerated program?
Yes. So I am doing a 2-year ADN-RN. I'm
Mhm.
considering doing dual enrollment. I haven't really decided on that yet because I know it's so much on its own. But
Mhm.
dual enrollment for the BSN, so we shall see.
Okay, in 2 year. Okay, so yeah, so my journey was basically I'm sorry. Your question again was I'm sorry. I'm just a
It's
little bit.
okay. It's okay. It's totally fine.
So, like, recommendations, suggestions for pre-nursing students going into nursing school.
Yes.
Yeah. So my nursing school experience, I have a previous bachelor's degree. So I did a 4-year undergrad degree at the university, and then I went into the world. And then I was like, hey, I want to be a nurse. I started working in a pediatric practice, and I started as an admin, and I was trained as a medical assistant. And then I was like, hey, this is what I really like. I like pediatrics. I want to do more. Um, Going to nursing school, I was basically the next step for me to be able to do that. So, you just really, like, before you really take that journey, you got to kind of figure out, is this what you want to do? There's, like you said, there's a lot to it. There's so many components. There's different programs. You really got to figure out what you want to do, where you want to go. You don't have to know exactly, like, I want to work in cardiology. I want to work on, you don't have to know all those answers quite yet. So you just have to figure out where you are in your life, what program is best for you. Since I already had a previous bachelor's degree, I did an accelerated BSN. So it was 15 months of intensive program, like fall, spring, summer, fall. Graduated in December. So going into nursing school, you just need to know and I'm pretty sure it's like this in any program, it's pretty intensive. It's going to be, you're going to have coursework, you're going to have clinicals, tests, papers, research. It's all going to happen, and you just really got to stay on top of it. So, just going into nursing school, you can't slack. You really got to put your, pedal to the metal and focus and, get it done. And one day at a time, one semester at a time. And it can happen. It can be done.
Awesome. So what are like some other nursing roles you can, um, insert yourself into that aren't necessarily bedside nursing? So I know like triage, phone triage, phone call. I don't know the word for it. But that's a thing. School nursing, things of that nature. But what other options are out there?
So there are limitless amounts of options for nurses. Whenever we think of nursing, we think bedside nursing. If someone's admitted to the hospital, the nurse that comes in and takes care of you. That's what, when I think of nursing, that's where my mind goes to, but there's so many things out there. First of all, there's different levels of nursing. I'm actually right now a pediatric nurse practitioner, but as an RN, whether you have a BS, whichever degree you have an RN, you can be bedside nursing, you could do nursing administration. If you're in the hospital, you can be a nurse manager. You can work in outpatient clinics. I personally worked in pediatric offices because I knew that I wanted to be in pediatrics, so I just stuck with pediatrics. So you could be in a primary care office. There's so many. There's even nursing opportunities where you don't even really do hands-on patient care. Right off the top of my head, I don't have the whole list, but there's nutrition, there's diabetes nurses, there's, nursing can be really broad, and then it can really trickle down into specific paths. And, for future nurses going out into the world, like I said, you don't need to have all the answers right now. But, say you graduate, you take the NCLEX, you're ready to work, and you're like, I just want to explore it all. Also, in nursing school, you do tons of clinicals. You do maternity, labor and delivery. You do psych. You do med surg. You do community health. You could be in a school. So you do get a feel for all of those different areas of nursing. So you can say, oh, hey, you know what? Med surg is really not for me. So that way, when you're going out looking for your first job, you're not going to go for the med surg jobs. Maybe you want to be in a cardiac unit. Maybe you want to be in the ICU. Maybe you want to be in the operating room. There's so many different areas. And, when you do graduate and you get that first job, it might not be your dream job, but get the experience, take some time, and you'll learn what you don't like. And say you do get that job and it is your dream job, you love pediatrics, you love being on the pediatric floor. And then, say you're working there for a while and you're like, I want to do more. You can figure out where you can move, where can you grow and transition in that role. And, it's just the experience and the time, and it'll take you there.
It folds on itself, and it builds on itself, and you're not necessarily stuck in one specialty forever.
Right. And also, as an RN, you aren't specialized as an RN. So you're not like bound to one unit or one area of medicine. You could be on the cardiac unit, then you can switch to school nursing. Like, you can move around, you have that freedom, and you're still within your scope of practice within that realm of the nursing world and what you are legally and licensed to do.
That's awesome. Now, for you, here's another, I guess, twofold question. So there's, I've heard, as I'm sure many students have heard, that you have to work in a hospital setting or med surg setting before you try to do something else. So I wanted to ask you what your thoughts were on that, and then why you personally, if you don't mind sharing, of course, decided not to go the hospital route and wanted to do more practice based.
Right. So so there's pros and cons of doing, starting off in that med surg. The med surg floor there's so much. There's people coming from post-op. There's people there for, appendicitis, someone there recovering. There's so many things on a med surg floor, and you're going to see a variety of cases and situations and medical conditions and a variety of ages as well. So it is a really good place to get your feet wet, and you can say, oh, you really experience so much compared to being on, I just keep going to cardiology, where if you're on a cardiac unit, it's all heart patients, it's just that. So I think, it's just starting off, if you really are unsure or unclear, you can definitely, that's a really good starting point on learning a lot and getting a lot of experience. Another example is in a hospital, you can do like maternity or postpartum, right? So you can be in labor and delivery, which is the active labor, and the nurse is by your side the whole time while someone's having a baby. And then the recovery part is a different nurse. It's a postpartum care. So you can graduate and you can, so someone who wants to be in like women's health, that's a really great starting point. If you know that that's where you want to end up, do it. That's great that you're going to see a lot and you're going to get a lot of experience, and then you can move on. You can go into the clinic and whatnot. So there's different areas, but I would say med-surg is really like a broad area to be. I specifically, so like I mentioned before, I graduated, I have a liberal arts bachelor's degree, no science, no nursing, and I went into the world and was like, I'm 22, I have no idea what I want to do. And then I lived in Boston, and it's a really great place for medicine. There's tons of hospitals, and I just, I was working in this pediatric practice, primary care practice, and I was like, wow, I really love this. Like, I want to do more. I, advocated for myself to become, be trained as a medical assistant there. And I went to nursing school, and then after nursing school, I worked in another primary care, and it's just really what I liked. It's what I knew. So after nursing school, I was like, if I do work in a hospital, I want to work at the children's hospital, or a peds unit in a hospital. But, a children's hospital would have been great. But I knew I wanted primary care. I liked that. So it was good because I was able to get that pre-experience to nursing school to know kind of like what I wanted, where I wanted to be later on. But not everyone gets that experience. So that's really what led me to stay out of that hospital setting. And then that's kind of where my path has taken me. And, I'm a pediatric nurse practitioner now, but I'm licensed and to be a primary care. So there's also an acute care track, which is more like in the ER and, the acute critical conditions where I'm more primary care.
Awesome. Thank you for explaining that. Yeah, I'm having a very similar path. I know I'm going a little bit off topic, but me personally, I'm having a similar path. I worked front desk for a lot of years, ended up working front desk for an OBGYN, loved it, wanted to do the MA thing, begged for them to train me as a medical assistant. They have. Now I'm, applied to nursing school, doing the whole thing. So what is, this is kind of an additional question onto, what I have prepared, but what made you, or how did you know like how far you wanted to go versus like staying in as just like an RN versus, going to advanced practice and becoming a nurse practitioner, or what are some good to consider to kind of determine which route you would like to take?
Right. This all goes back to like that office that I began working at. It was a medium to small size practice. So I got a chance to really get to know the doctors and the nurse practitioners that work there. And I saw what they did, and it was awesome to me. I was like, wow, like this is what I want to do. Like, I really, like, I saw it firsthand, and it was kind of like a mentorship. So in addition to working there, I would, hey, do you mind if I like pop in with you? If you could show me like X, Y, and Z that you're going to look at. And they were really good with that. And maybe that was being in Boston, and they're all like, everything's about teaching. They just want to teach, and they've got lots of medical schools and all that there. So maybe that was part ingrained in them a little bit. They're like, yes, we want to teach you. But they were just really open to that. And I feel really fortunate that I got that chance to experience that, because not everyone does get that pre-experience and that exposure to really let them know or help them, guide them in that pathway.
Awesome. Wonderful. So in terms of like, I guess with everything again, going on, I with, you know, the Radon Devot case and, you know, the many others that are kind of coming
Mhm.
up now. What are some good things to, like, okay, going into your first semester of nursing school, for example, to kind of like, okay, these are foundations that I need to really stick to, or really not. I mean, I know how intense nursing school is and you can't really skate by on anything, but to really be extremely disciplined with yourself on in the beginning so that it doesn't affect you, you know, negatively down the road. Not saying, you know, anyone is to blame for what's, you know, going on
Right.
currently, but some things to look out for.
Well, when you're in nursing school, they really like ingrain it in you. You know, there's like your scope of practice. There's, you know, there do no harm, do no harm, and you know, no nurse is going into their practice or going to work every day saying, what bad thing can I do today? Nurses are out there to help people. They are not out there to hurt people. And um, I just think like I don't want it to deter people of, you know, to go into the practice because it's a really good profession. It's really, it's a stable career, and it, you know, there's so many opportunities. There's different types of shifts and roles that can fit into many people's lifestyle. And it can be scary, you know, it's a big thing. You're giving people really serious medications, you're injecting things into their body, and that's a serious thing, but it's you got to go into it not thinking you're going to hurt somebody. You say you're there to help someone, and then when you get into that practice, you just become disciplined, and you know that if you're giving a medication, if you're injecting something, whichever thing you're doing, you double check, you triple check. It's if you don't know, and even being in nursing school, because your preceptors and your clinical instructors will, you know, let you do things. And even if you're in nursing school or an actual nurse, like my number one thing is ask. If you are not sure of something, speak up. Ask someone above you, ask a nurse manager, ask a physician. People are there to help you. Um, no one wants anyone to get hurt or get in trouble or do anything. And I'm just like huge advocate. If I don't know, like me personally, if I don't know something, I'm like, excuse me, I need help. Like, you know, so it sometimes feels because the nursing world right now, it's, you know, people are overworked and they're understaffed, and the patient to nurse ratio is insane in certain places, and it probably shouldn't be that way. And it's hard because you're like, I'm overworked, you're stressed out, you're overwhelmed, and there's so much going on, and you have one patient over here beeping their their clicker as they need something, and you have this one, you know, and you look at your acuity levels, and I can't imagine what it's like going on in someone's brain, and they're like, oh my gosh, like I am doing the best that I can, but I'm like treading water here. It's, you know, like people, future nurses, like those things exist. Um, but you can't go into it fearing that bad things are going to happen to you. You just got to work hard, do the best you can, follow all the rules and um, guidelines that you've learned through nursing school, and just take it with you, and you'll be good.
Thank you. Now, what is something that you can, a pre-nursing student or someone who's in nursing
I'm sorry.
school?
I'm sorry. Can I pause you for 1 second?
Yeah. Uh-huh.
I just need to get a charger. So my computer is about to
Oh,
die.
oh, please go ahead.
I'd rather get the charger before it pops off. I'll be right back.
No worries.
I'm coming. Sir. Okay.
Ah,
Okay. All right. Good. I just didn't know what to turn off and then
no,
load it back up.
you're totally fine. Thank you. No, you're good. You're good. I had my technical difficulties
Yeah.
start, so you're good.
Okay.
Now, for someone who, like myself, who's hopefully getting ready to start, her first semester of nursing school in the fall, or current pre-nursing students, what are, or current nursing students even,
Mhm.
what are some things that you can do now to help prevent burnout throughout school,
Through school.
or even or
Well,
job, even on the job?
so for school, it's going to be a lot, and depending on the um, the program, um, the program that I did specifically, they were like, you cannot work. You're not going to be able to work. You just need to not work and do school all the time. And being an adult learner at that point, it was that was a big jump. But I did have some students in my cohort that did work a little bit. But in terms of burnout, you just gotta keep day by day, right? You're gonna have a lot of work. You're gonna have some papers and research and lab work, and it's going to be a lot, but you just really need to be organized. It's all about those organizational skills, and you know making a calendar, writing out what needs to be done, and planning out when say you have 3 assignments that are due in 3 days. Set out an hour each day for that assignment, or if you're studying, anything like that, plan it out. I think organization is the best thing that anyone can do. If someone's like papers all over the place, there's nothing's written down, you have no idea when things are due. It might get done, but might not be to the best of someone's ability. So it's just like studying for tests. Planning it out, getting sleep. Sleep is a huge thing. So you're studying till 10 p.m. Just turn off the computer, put the book away, go to sleep. And hopefully, you know, that'll be the key to preventing burnout. But it's a lot. It's a lot. And some people are going to be overwhelmed, but it's really important to remember, and just anything in life, is to just take the time for yourself. Take a deep breath, take a step back. If it's too much, go for a walk, clear your mind, and then start fresh again in a little while. So it's hard. Everyone has different experience, and the course load could be different, and some people have children at home and family to feed, and some people live with their parent. It's total, everyone's situation is different. So, but overall fundamental skills is just like studying for a test, is lay it out, stay organized, keep on track, and hopefully that helps prevent some burnout at least.
Yeah. I mental health is a big thing too. Like I, struggle with anxiety, and I have ADHD and depression and like all of those things, like I'm sure so many people do. And is it I'm trying to figure out the way to phrase this question. So if I think about it, I think about, okay, my mother is a caregiver. She's, a caretaker. That's her natural thing. And doing so much for everyone else, she has a hard time doing it for herself.
Right.
So very much that same kind of thing, with being a nurse. And I'm still trying to focus on taking care of my mental health as well. Like I'm trying to think of, for myself and others who struggle with mental health issues, to not set yourself up for failure kind
Right.
of in terms of being able to I guess have coping skills or mechanisms and things of that nature, or so that you don't get to that point of that mental health struggle.
Right. There's, this goes back to the like staying organized, doing all that. You could say those things for days, and those things are really important. But whether you're in the nursing profession, like have a job, you know, you're going to have your shift, you're going to have your schedule. You're not going to be working 24/7. So you just have to, anyone that is feeling, this anxiety and the stress and the overwhelmingness and like overworked, it's really, really important to take that time. Sleep is a really important thing. And keep saying it. It's like, take the time to yourself. And I know a lot of people, sometimes it's like you said, it's hard for them to really step back and be like, okay, me, I have to take care of me, not everyone else. It's hard to say, this is right, this is wrong, you can do this, not this. And I would suggest and recommend anyone that's getting extremely overwhelmed, feeling like you can't wake up in the morning, you can't get yourself out of bed to go to work, you can't do this. It's really important to speak to someone. Even if you're in nursing school and it becomes too much, reach out to the resources at your school. They might have, I'm pretty sure they'll have a mental health counselor or a department where you can go and they are just seeing students, because it happens a lot. And a lot of people experience it and not a lot of people talk about it. It's something, just talking, finding someone to just talk to, even if it's a friend, if you don't want to go see someone, but just getting it out there rather than letting it be inside. Talk to a dog, talk to your cat. It's like getting out. You might feel bad just a little bit. I don't know. I don't have all the right answers, but
Yeah, no, it's one of those things. It's definitely, what you resist persists, you
right.
know, to talk about it, to try and work through it, to deal with it, and that it's okay to take a break. I do know a couple nursing students who have taken a semester kind of hiatus,
Mm-hmm.
um, back in the following semester, just for self-care and mental health stuff and family stuff. And especially the world right now is so crazy. It's like every day you wake up, there's some new crazy thing that's going on.
Right.
So I really appreciate the chat and the insight into how to best, begin building those habits now to take care of yourself, so
Yeah.
that later on the road, when things get really, hardcore,
Yeah.
and you have a plan of action.
Right. And for even pre-nursing students, just know that those resources are out there. And the university that I went to, they were there, and they're sitting there like, come to us, talk to us, help us. So if you feel alone, if you feel like there's like no one to talk to, they are there and they're there to help. Um, I personally, when I was in my graduate portion of nursing, not necessarily mental health related, but I had a baby. So I started I was starting my year 2 out of, there's 2-year program. I started year 2 in September and I had a baby in October.
Mm.
I spoke with my director, we made a plan, I made a plan to do a maternity leave and be able, so whatever the situation, talk to them. They're willing to work with you. They don't want you to fail. They want you to succeed and they want to help you. So just utilize the resources that are available.
Awesome. Thank you so much, Melissa. I because this will be shown later on.
Yeah.
So is there anything you wanted to share about Smart Edition and, you know, building that? It helped me so much, to do super well on my T's. And I
Right.
know that is changing and the NCLEX is changing. So I know that's I'll be, I think, one of the first groups to take the new NCLEX when it's my time, hopefully. Um, so, if there's anything you had to share on that or insights, between the T7 now or new NCLEX and all that, those good things.
In terms of studying and everything, it's, utilize the resources, especially for getting into nursing school and doing the T's. Smart Edition is a really great program. I've helped do a lot of stuff with it, build the curriculum and everything. But when you're studying and getting ready for the NCLEX or the T's, just, look at the test, see what's on there, and just really focus, going back to getting great sleep and making a list on what to study, when to study, plan out your studying. Say, okay, I'm going to do 1 hour of science. I'm going to do 1 hour of math, 1 hour of anatomy and physiology. Really plan it out. When you plan it out, you really make sure that you cover the topics that you are being tested on. And it's really going to help prepare you, and it's going to help you develop good skills that are going to, preset, your future, going into the work field or going into nursing school. It's really going to help you start that journey of learning and getting prepared. And I know that I can speak about the NCLEX taking the test specifically, but there's a lot on the test, and there's no way you're going to be able to study everything, every single topic, but just really you have a chunk of time where you can just study, and you're not in school anymore, and you're just studying and cover all the topics. You might not know exactly how to read. Gosh, I'm sorry. It's been a long day, but you might not know exactly, because there's a lot of things on there that you're going to learn when you're in the field. So they're just, learn how to read the questions. The NCLEX, it's tricky. The questions are asking you something, and they're asking you which answer is more right, because all the answers are correct, but which one is more correct? So they get tricky. Just make sure you read the questions and really just take the time. And when you're practicing T's and NCLEX, practice taking the test. There's different test formats or test question formats, and you just got to be used to them. So when you're taking that test, you're like, oh, I remember, I know, select all, and read the words and read it slowly and take your time, and you'll succeed. When you're rushing and last minute and you don't know where your papers are, it gets chaotic, and everything else gets chaotic around you. So really make that plan.
Yes, I can definitely attest to that for the T's. And I will say, I'd like to thank you personally. I am almost done A&P2 now, thank God. But I took my T's, after taking A&P1, and using Smart Edition, and going through all the modules and, the book and everything. It's prepared me so much for.
Oh, that's great.
It's been wonderful. So to anyone who will be watching this later, if you haven't taken A&P2 yet and you're taking the T's before, Smart Edition will help you so much, because I'm definitely ahead of the curve from a lot of my other classmates. But yes, having the plan helps me, and just really, being disciplined. I think that's the hardest part in all of this. I think I'm at the point, I know it's only just beginning, but we're no longer motivated at this point. We're tired. It's just
I know it's really all about discipline, and just think you're going to need to be disciplined when you go, if you're a bedside nurse and you're in the hospital, you need to be organized and disciplined. You need to know you're going to get in there, you're going to get the morning rounds, you're going to get the turnover from the shift before. Then you need to know, what do you do within that 12-hour shift? Where do you start? What do you do next? And if you stay organized, have a plan, it's going to set you up for success for that, your career as well. So it doesn't end here. It takes it with you.
It keeps going. Okay. Well, is there anything else that you would like to say? I know you're busy and you have a life, and I'm so thankful for you taking the time to do this and to chat with me and pre-nursing and nursing students out there. But is there any last words of advice or encouragement for those who are still kind of on the fence? Especially those of us who are older. I'm 31, and it's like here I am coming into this field where everybody is leaving. So
Yeah. So there's so much. I became a nurse. I was 29, 30, so I was older as well. And then, being a nurse and going through graduate school, I have had 3 children since then. So, it's doable, and nursing is a really great career. Like we talked about earlier, there's so many different pathways you can take. Um, you can work you could do travel nursing. There's so many different opportunities. So don't read all this, don't read the horror stories. It's just like if you have an itch on your arm and you Google, why do I have an itch on my arm? It takes you down a rabbit hole of awful things. So just do your thing, follow the path that you want to take and stick to it. It's going to be good. It's going to be good in the outrun. And it's a really rewarding career. You get to meet so many people, you get to see so many things, you get to learn so much. And I think it's a great place to be, and there's limitless opportunities.
Agreed. Well, I hope you have a fabulous evening. Thank you so much again for taking the time to chat with me, and hopefully as I progress or as I get more questions from other students, in a couple months, we could do this again. I would really like
Yeah.
that.